Good morning, everyone. My name is Jesse Trung, and I'm an accredited exercise physiologist. Thank you for coming in today. I'll give you a brief rundown of Diane. Diane is a 67-year-old retired school teacher who, over the last 6 months, has been battling with breast cancer. According to the TNM model, she has been diagnosed with stage 2 tumor. So that's greater than 2 centimeters, but is less than 5 centimeters in dimension. Her secondary staging is stage PN1B, which is metastasis of the internal mammary nodes with micrometastasis or macrometastasis detected by lymph node biopsy, but however is not clinically detected. There's been no clinical or radiographic evidence of distant metastasis. She has elected to have a full mastectomy of the right breast and has completed her radiation therapy. She has been recently diagnosed with peripheral vascular disease, adding to her current comorbidities of type 2 diabetes and hypertension, both whom which she is currently medicated for. Diane's current goals is to improve her levels of cancer-related fatigue, improve body image, increase function, especially for activities of daily living, address social withdrawal and mood concerns, and to reduce dependence on medication. Currently, Diane is not receiving any form of cancer-specific treatment, so the oncologists and oncology nurses have not been included in the TCA. However, Diane is still scheduled to have ongoing reviews with her oncologist to monitor her condition, just to ensure that the cancer does not come back, or if it does, it is flagged immediately. The current team of allied health professionals is led by the general practitioner, which will oversee and manage the other team members. The non-core team members consist of the psychologist, dietitian, and myself, the exercise physiologist. The psychologist will manage the psychological distress which can occur at any stage of the disease in the cancer patient's life, from diagnosis to end of life period. This unpleasant emotional experience, which can consist of any combination of cognitive, behavioral, emotional, or social factors, may interfere with the ability to cope effectively with cancer, its physical symptoms, and treatment. Distress can range from common normal feelings of vulnerability, sadness, and fears to problems that can become disabling, such as depression, anxiety, panic attacks, and social isolation. Specifically, for Diane, this would be excellent to address and manage her mood concerns, relationship, and overall trauma and coping that comes with cancer. As Diane has currently has as Diane currently has other diseases which have been attributed to her lifestyle choices, Diane would really benefit from having professional advice from a dietitian who will be able to liaise with the medical team to help translate nutritional goals for the best possible treatment outcomes. Dietitians also assist in educating the clients about tailoring their diet to their goals. For Diane, she requires this assistance to manage her type 2 diabetes and her hypertension, as well as provide enough energy and nutrients in order to reap the rewards of the physical improvements that are achieved through exercise. The exercise physiologist can assist the patient through exercise intervention. A cancer client can help develop positive benefits to their health, including significant improvements in functional capacity, muscular strength, cardiovascular health, flexibility, and balance. Exercise intervention can help psychosocial improvements, including increased vitality, social functioning, well-being, and reductions in stress. There is also increasing evidence which supports regular physical activity, extending and improving quality of life for cancer survivors. Physical activity after a breast cancer diagnosis may reduce the risk of death from this disease. It has also been reported that diabetes has been associated with a higher risk of breast cancer relapse and mortality relative to those without diabetes. For Diane, this multidisciplinary approach is required to maximize the chances of survivorship. As Diane is looking to improve her aerobic capacity as well as physical function, a stress test that will be suitable for this patient is a 6-minute walk test. This can be done after gaining medical clearance from her general practitioner. The 6-minute walk test will be performed on a treadmill with an ECG being attached to her. This will measure her electronic signals of the heart. As the patient has poor physical conditioning and is dealing with cancer fatigue, the test will evaluate her aerobic capacity to exercise or VO2 max. This will be used in the future as a point of reference to be compared against. For this test, Diane is required to walk as far as she can in that 6-minute period. While she is performing the test, the measures that we put into place are blood pressure monitoring, heart rate monitoring, oxygen saturation, a dyspnea scale, and as Diane has other comorbidities, an angina scale will be required, both while she's exercising and performing this test. With this test, there are absolute and relative contraindications for terminating the test. These include systolic blood pressure decrease of greater than 10 millimeters of mercury from baseline with an increase in work rate and schema, moderate or severe angina, dizziness, ST elevation of greater than 1 millimeter, unexpected ST or QRS changes, leg cramps, claudication, poor perfusion, or subject request. She also is currently medicated with medications such as a calcium channel blocker, a beta blocker, a statin, and metformin, which is used to control her type 2 diabetes. The combination of these medications will affect her heart rate and her performance. These medications make it more difficult to accurately use maximum heart rate as a measure of intensity. A scale that is more appropriate would be the RPE scale of 6 to 20. In the 6-minute walk test, Diane managed to walk 300 meters in that time. According to normative data, that would give her an approximate VO2 max of 10 milliliters per kilo per minute. The score would place her in the very poor bracket for clients in the same age. This test was terminated due to the client's willingness to terminate. When this was investigated further, she complained of being out of breath, complaining of cramping in the legs, whilst she was noted to lose pallor and became dizzy. Her ECG, however, was normal. Functional testing was also completed to assess the range of movements across the various planes. There was quite a deficit on the right upper quarter of her body as a direct result of her mastectomy. Diane is also right-handed, so the surgery has greatly affected her ability to perform day-to-day tasks, and she is more dependent of the use of her left hand. She has begun to develop more neuromuscular control and coordination of her non-dominant side, as well as beginning to build strength. Another point to make note of is the weakness in both of Diane's knees. Her current physiological state would suggest high pressure of her knees, and therefore weight bearing would become a barrier, as she may have early signs of osteoarthritis. There are other useful scales and questionnaires which would assist the health practitioner in assessing the patient's current state at both the initial consultation and the consultations following. These include the multi-dimensional fatigue questionnaire consisting of 30 questions. This would obtain scores for 5 subscales, including general fatigue, physical fatigue, emotional fatigue, mental fatigue, and vigor. This can be completed at the first session of each week just to track how Diane is traveling. The quality of life was assessed through the Functional Assessment of Cancer Therapies Breast, or FACT-B. The FACT-B is a multi-dimensional quality of life questionnaire specifically developed for breast cancer patients. In breast cancer survivors, if the heart rate reserved is used as a guiding factor, the intensity prescriptions are generally too intense for training. Prescriptions using VO2 max results in a slightly too low exercise intensity. This is why the RPE is the best form to measure intensity for Diane. As Diane has multiple factors which will affect her exercise program, we do need to take these into consideration. To cater for her needs, a cycle ergometer would be a great way to increase her cardiovascular fitness without her needing to weight bear. This form of exercise will definitely assist her in reaching her goals, and a gradual introduction into walking for extended periods will come later on in the program. Research has shown the greatest benefit occurred in women who performed the equivalent of walking 3 to 5 hours per week at an average pace. Cancer survivors are recommended to perform 150 minutes per week of moderate or 75 minutes per week of vigorous aerobic exercise, according to the ACSM guidelines. Objective measures of cardiorespiratory fitness, such as VO2 max, have been associated with a lower risk of cardiovascular disease mortality and cancer mortality. The combination of strength and conditioning as well as cardiovascular fitness has shown to be the greatest improver of overall fitness for breast cancer survivors. At diagnosis, the cancer survivors showed an approximately 30% lower VO2 max when compared with the same age and sex without a history of cancer. Previous studies have shown a worse cardiovascular disease risk profile among breast cancer patients compared to healthy patients. Cardiovascular disease is also a leading cause of death among breast cancer survivors. There is significant bone loss is a side effect of breast cancer patients, which often goes untreated and undetected in pre- and postmenopausal women. A combination of aerobic and resistance exercises may be effective in reducing this risk. Moderate intensity exercise not only maintains but significantly improves aerobic capacity and muscular strength in women undergoing chemotherapy. Diane can elect to do home-based aerobic exercise programs such as walking or jogging and exercise for 15 to 30 minutes per day, various days per week, to meet the minimum 150 minutes or 75 minutes of vigorous exercise. Education and empowerment are the keys for survivors to be pushed to their limits and manage them when there is an onset of symptoms. Diane will be encouraged to push the intensity where breathing is difficult, but she is still able to talk. Resistance exercises will be demonstrated to Diane, and she'll be instructed to exercise at home throughout the week using the TheraBands. The difficulty with the tubing depends on the color, with darker colors holding more resistance. As Diane gets stronger and stronger, the color of the band will get darker and darker. The intensity and volumes of the exercises will be controlled by the number of repetitions and sets. Diane will reap the rewards of exercise with 2 to 4 sets per exercise and 8 to 10 reps per exercise. These exercises are generally split between 4 upper and 4 lower body exercises. There is an emphasis on body function improvements. This can be achieved with sit to stands, squatting, lunging, and reaching for objects. These exercises will be targeting the major muscle groups used in everyday activities. As her range of motion has been inhibited, there are specific times in the program where she's been allocated to perform her stretches. Without building up the range of motion, Diane will still find difficulty in performing tasks, even with her new gained strength. Diane will be encouraged to weight bear in all exercises, but she will also be educated on how to complete the exercises while sitting down or lying down if she were too ill or tired to complete them while standing. Diane is also encouraged to keep an exercise log of the number of repetitions of each exercise, resistance of the band or tubing, and the duration of the session. In the initial phase, Diane will be seen twice per week to introduce her to the various techniques and exercises she will use throughout the period. After this first week with 2 sessions, she'll be seen once per week, and as a key part of her program is to comply with home-based exercises. There's an increased emphasis on home-based exercises as she progresses through her journey. Diane will be introduced to group classes where she'll enjoy social interactions and social support with other cancer survivors, as she can also achieve her exercise goals. After 8 weeks of training, Diane is to increase her VO2 max from 10 milliliters per kilo per minute to 20 milliliters per kilo per minute. She is currently a great number of factors that have affected this result. Her results in the 6-minute walk test would be estimated to be around 500 to 550 meters, which would reflect her aerobic capacity. Studies have supported improvement in VO2 max, reducing mortality risk by 12%, with an increase of only 1 milliliter per kilo per minute.